My name is Alexandra Olsen. I'm a communications officer at the WHO Regional Office for Europe. I'm very happy to welcome you at this webinar on alcohol availability policies. This is the third webinar in a webinar series on alcohol and cancer that was developed by WHO Europe and the International Agency for Research on Cancer, IARC. This webinar series is part of the WHO EU Evidence into Action Alcohol Project, EVID-ACTION, which is funded by the European Commission. The project supports EU member states as well as Iceland, Norway, and Ukraine in adopting and scaling up best practices to reduce alcohol consumption and related harm. Please note that the webinar is being recorded and will be made publicly available on WHO Europe's website as a resource for continued learning and dissemination. Today's session will focus on regulating access to alcohol to reduce consumption, because as we know, the more available and frankly everywhere alcohol is, the more people, and in particular vulnerable groups, consume it, harming themselves and others around them. So our experts today will dive into what works to reduce alcohol availability and what tangible effects this can have. I will start with just a few words about the format and structure. As I mentioned, this series was created jointly by WHO in Europe and IARC, building up to the launch of IARC's Handbook 20B that evaluates policies to reduce alcohol consumption and harm. The launch will happen in October this year. If you're interested in learning more about IARC's work and the handbook series, you can have a look at some of our previous webinars, and I'll be sharing a link in the chat to this in just a few minutes. In this webinar, we will unpack some of the results of the handbook evaluation in a plain language and interactive manner. We'll have a Q&A format with 4 planned segments, and additionally, we encourage everyone to ask our experts questions using the Q&A function or the chat. So please do use that actively. And I'll try to pause and take a look at that once in a while as well to source some questions. With this, I would like to introduce our 3 main speakers of the webinar today. Professor Taisha Huckle from Massey University of New Zealand, who is subgroup chair of the availability section of the IARC Handbook Volume 20B. Juan Tello, the head of the Less Alcohol Unit of the WHO headquarters in Geneva. And Runa Neely, public health specialist at Systembolaget, the alcohol monopoly in Sweden. We are also very happy to have with us Dr. Jürgen Rem, a senior scientist from the Center for Addiction and Mental Health in Toronto, Canada. Additionally, we have colleagues from IARC and WHO joining us in the chat to answer some of your questions. And as I mentioned, when not presenting, all of the speakers and the extra experts will keep an eye on the chat and the Q&A. And we'll try to take this with as few slides as possible and as much interaction and questions as we can. So with this, I think we will jump in. And let's start with looking at the IARC handbook evaluation. So we'll start with Dr. Huckle. Taisha, would you tell us a little bit about which availability interventions were evaluated for the IARC handbook and what were the main results? Over to you.
Thank you. Kia ora, everyone. As it's been said, my name is Tasia. I work at Massey University in New Zealand. So I've been asked to come along and talk to you a little bit about what availability policies that we looked at and what we evaluated, and also the reasons for our evaluations. And it also says here in a nutshell. So literally that's what I've done. It's going to be very brief. So I'm going to share my slides and I will talk through them. Okay. So on the left-hand side of the table, we can see the availability policies that we did evaluations on. And on the right-hand side of the table is the reasons that we gave the evaluation. So we evaluated alcohol outlet density. We evaluated days or hours of sale. We evaluated minimum purchase or drinking age. And we also evaluated total bans on sales. So when it came to alcohol outlet density, we had 6 studies that were included in the evaluation. And the group decided that there was sufficient evidence that restrictions on alcohol outlet density lead to reductions in consumption. And the reasons that we gave this conclusion were high quality studies showed an inverse relationship between restrictions and consumption, and also confounding could be ruled out. And all I mean by confounding is that other variables or other factors that could influence or affect the results in some sort of way. I mean, there's a more scientific reason than that, but I'm being very simple. Could be ruled out. In terms of days or hours of sale, we had 10 studies included in the evaluation, and the group evaluated that there was sufficient evidence that restrictions on days or hours of sale led to reductions in consumption. And the reasons for this were that the changes in the days or hours of sale were associated with changes in consumption in the direction that we had expected. That there were several high quality studies, and that also all studies either had a control group or they had controlled confounders. So in terms of when we looked at the minimum age for purchase or drinking alcohol, there were 14 studies. The group came to the conclusion that there was sufficient evidence that if you increase the purchase age or increase the drinking age, that consumption is reduced. So the reasons for this were that the direction of consumption change was consistent with the direction of the policy change in most of the studies that we looked at. We saw the effects in the age group affected by the policy, so that was a key one for the purchase age or drinking age, and that confounding was ruled out in the strongest studies that were included in that bunch of 14 studies. We also looked at total bans on sales. We had 9 studies, and the group evaluated that there was sufficient evidence that total bans on sales will reduce alcohol consumption. And the reasons for this evaluation was that we found consistently large effects in the studies and the literature. And these effects were also found across a range of settings, so different countries and different income levels. So for example, in high income level and low middle income. So those are the summations of the evaluation policies that we evaluated and our conclusions and the reasons for why we made those conclusions.
Can I ask you, what do you think, in your opinion, where is some of the strongest evidence for which policy would you say is there the strongest evidence that it works in terms of?
Okay, rightio, that's good. That's an easier question than the one I've got down here. I mean, we've got really strong evidence for minimum drinking and purchase age, I feel, and also days and hours of sale. I mean, we do have strong evidence for total bans on sales as well, but those would be my picks.
Okay, and if you had to choose one policy to implement on availability, what would you go for? Or does it not make sense to go for one? What would you think?
Well, I could cheat and say I would go for reducing outlet density, reducing days and just trading hours and minimum purchase age. I think, of course, a package would always have more effect and be more effective. But if I have to pick one, I would pick days and hours of sale.
Okay. And were there other policies evaluated as well, except for these ones, or was this these were the ones with sufficient results, right?
Well, we did look at some other areas. We did, but as we worked through the process, either we came to the conclusion that the evidence couldn't be evaluated. For example, it was confounded, or the studies just simply weren't strong enough. So we did look at, for example, location, we did look at partial bans, and we did look at online delivery. And, for example, in the case of online delivery, there weren't any studies actually that had looked at a policy change. So, yeah.
Okay. And would you say also a few words about like the actual process of the evaluation and how IARC does
Sure.
this, just in a few just for
Yeah,
people to
so
understand what goes on.
certainly. So it started out with IARC doing a systematic review of the literature. And then what we did was there was a process of getting together on Zoom meetings, and each of our subgroups, so the availability subgroup would have Zoom meetings, and then we would discuss studies we wanted to include and exclude. There are, of course, some overarching inclusion and exclusion criteria. And then we went, how do I say it? We, in intimate detail, went through the studies, line by line, result by result. It was an incredibly in-depth and thorough process. And then we all met face to face for a week, and we all continued that process. And then at the end, we made our evaluations, and we had strict guidelines around the evaluations. So it wasn't just, you know, we had some guidelines to base how we were supposed to judge the evidence. And then, yeah, we voted, essentially, the whole group voted.
Okay. Sounds very interesting and very rigorous, for sure. I don't see yet any questions in the chat, so people attending, please think of some questions also for Taysha. And for now, we will move on with the program and then look at some of the alcohol availability restrictions in practice. And we'll start with the global level. So I'm turning to you, Juan. If you could give us a global snapshot from WHO of what kind of restrictions countries usually have to control where and when alcohol can be sold.
Thank you. Good morning, everyone. A pleasure to be here. And definitely my presentation will complement what Professor Hackl mentioned in terms of the evidence, because these are the restrictions that I will describe more into detail and how they unfold at the country level. In a study that we have published, and we can share in the chat later the link to it, we look at 30 countries across the globe. 2/3 of them are low and middle income countries. All the regions of WHO regions are represented, all the continents are represented. And what I present is a little bit a summary of the aggregated data. So we heard previously that the minimum legal age is a good restriction for decreasing consumption, alcohol consumption. And that's confirmed that most of the countries, these 30 countries, they all apply this restriction, this measure, as for restricting availability of alcohol. But you see here on the top of this slide on the left, you can see that the age of legal purchasing age, that's what we looked at, it varies across countries. So most of the countries establish it at 18 years old, but you can see a few with different outliers, if you want, in different ages. So here we look at purchasing age in terms of off and on premises. So that's also interesting to notice. There were no differences between the premises. So in and off and on were the same age in all these countries that we looked at. But interestingly, let's look at what regular. So the way we did it, apologies, methodologically was a legal epidemiology approach. So we look at what countries are regulating in practice. So we look at policies, laws, and regulations to understand better what they are implementing. And you can see here that most of the countries also anticipate some of the penalties that they will that the providers will face in case of breaching the minimum legal age. And you see most of them are looking at fines, others incarceration, usually when they repeat the breaching, and then others other methods, for example, losing the license for selling alcohol. Interestingly, is also the end of the slide here on the top, where you can see how this is enforced, and that's where we really have a huge gap across the different countries. You have only 11 countries with concrete enforcement compliance checks, while the rest of the countries usually they don't look at or they don't describe very concretely how this is enforced. In terms of the licensing categories, maybe I will just skip this to move to the next and then to the next slide if I manage. Yes, because I think to recall the evidence that was mentioned by Professor Hackel, what I will suggest is that we look how or where the restrictions apply. So there are concrete premises spaces where 12 countries ban alcohol sales. For example, usually they are health facilities, they are educational facilities, but also houses of worship, as you can see here, sport facilities, petrol station, or child focus businesses as well. Less countries establish the distance, the minimum distance for or standards for the location of the alcohol outlets, and mostly these countries are around, or these standards are around educational facilities or houses of worship or medical, in this case, health facilities or treatment centers. So this is also very interesting because there is no consistency across the countries, but you can see the number is very low. It's 1/3 of the countries that we look at. Finally, in terms of restrictions of alcohol for days, we saw that most of the countries, so 2/3, did not regulate the days of sale of alcohol at all. That's also very interesting, with some details on the number of hours that the alcohol could be sold. And in this case, usually there were restrictions that were not clearly stated in the legal documents that we look at. And finally, you mentioned, Professor Hackel also mentioned the delivery at home, and we see that what we look at is in terms of the age verification, because that was something that also links to the other measure of minimum age, is that when we have home delivery, it is very difficult to enforce the controls around aging, and we see age. And we see that most of the countries, that the study spans from 22 to 23. It's basically in that period, the delivery was not properly regulated. So we have 2/3 of the countries not regulated. And I stop here for other questions. I don't want to take much of your time.
Thank you so much, Juan. I think that was a very interesting overview, and I think it looks to me, at least from this, that some of the policies evaluated to be effective are implemented to some form or another in countries, and it looks like there are some areas that are more tricky, like the regulating alcohol delivery and online sales. Is that correct?
That's correct, particularly, of course, from 2020, when the online sales increased dramatically in many of the countries. There are some summary or synthesis of the evidence that has been collected during that period. I can share, of course, some more details on the, but Professor Drangenstein from the US basically has a study what happened also in many high-income countries. We don't have a lot of evidence from low and middle-income countries. We have also evolved in terms of in terms of providing better guidance to countries on how to regulate in general online marketing. And I think that will be part of the conversations in the next webinar. So for those that are interested to understand more, we invite them to participate to the next appointment that will be in a month's time.
Yes, that's great, and a great preview for that one as well. I think absolutely a lot of lessons to learn. But maybe just a last question for you, Juan. From this overview you had, what lessons do you think governments can take forward to make alcohol availability policies more effective in their countries? What do you think?
Thank you, Alexandra. Yes, well, I think the reflection was more for WHO, and this was an exploratory study to understand how WHO could contribute to develop the national capacities in order to regulate better alcohol availability. That's the truth. So the takeaways for WHO, but probably you will resonate at the national level, is the fact that we need more standards to understand, for example, when we said, yes, locations or outlet density, it's important or it is not important. When we see how that plays out in practice, then we see that there are many differences. For example, countries will regulate alcohol outlets at 100 meters from school, others up to 500 meters from school. So there is no really evidence that we can provide that was made clear. However, the development of more practical cases and to understand pros and cons and see how this has impacted the in terms of the outcomes, that will help also countries to understand better or to have more guidance from WHO perspective of what standards they can implement. The other lesson is that we have seen that we are very good sometimes at developing policies / laws or generic laws for alcohol control, but those laws need to translate into operational legal frameworks or regulatory frameworks. The names, of course, will change from country to country. Sometimes countries are delegated subnational level, and subnational level do not necessarily have all the know-how to implement those laws. And that's also a message for all of us.
Yes, thanks a lot for that. I think that's definitely the discussions that are happening. So the implementation level is very important once theoretically the evidence is clear, and there are also some good country practices, but no one size fits all, and support and implementation. I think that's very useful. So thank you so much for that, Juan. Before we move on, I'd like to mention that the IARC Handbook 20B also evaluated the impact of coordinated multiple alcohol policy interventions, such as alcohol monopolies, and found that these measures reduce alcohol consumption at the population level, which is why in this webinar, we would also like to include the perspective of, in particular, Nordic alcohol monopolies, and look into how alcohol availability is restricted in the context of Nordic alcohol retail monopolies. With us, we have Runa Neely from Systembolaget in Sweden. Welcome, Runa. And I would just like to ask you, and for our audience as well, what are the Nordic retail monopolies and how are they different from typical alcohol retailers in Europe?
Hi, and thank you for having me. Nice to see everyone. So when I was preparing for this webinar, I realized was trying to write down, all the differences and realized that could be a 1-hour presentation in and of itself. We have less than 10 minutes. So what I will do is just give a very kind of quick overview and mainly talk, of course, from a Swedish perspective. So Systembolaget, where I work, but I highly recommend reading the Nordic monopolies report by the WHO Europe that came out this spring, I believe, if you want to also dive deeper into Alko and Vinmonopolet and the other monopolies in the other Nordic countries as well. But essentially, if you've never heard of a Nordic retail monopoly of alcohol, the basic is that it's a state-owned retail that has the exclusive right to sell alcohol in the country over a certain percentage. So in Sweden, anything that's 3.5% or higher is sold at Systembolaget. And there are several different ways in which these monopolies and Systembolaget specifically differ from more classic or retails that you can see in other parts of the world, Europe and globally. I think, Alexandra, you have my slide up, unfortunately, on my phone, so hopefully you guys can see it. There I've written down some of the more like details, but I would say bigger picture, one of the main things that sets Systembolaget and the Nordic monopolies apart is our emphasis on public health and social responsibility. And I actually wouldn't even say emphasis is the right word. It really is the core of the monopoly and the whole way it is designed and structured to minimize alcohol consumption on the population level and thereby minimize harm. So really what this whole webinar is about, limiting availability, both through hours and days. For example, we're closed on Sundays and close early on Saturdays, have limited operational hours and density outlet limitations. So this is, of course, very unique. And then I would also add additionally that we have a government mandate from the Swedish government to inform about the ways in which alcohol affects both the individual and society at large. So this is a huge part of my work and what I do at Systembolaget together with my amazing colleagues. So this is quite different. If you've never heard of a Nordic monopoly before, then this is quite different from retail you would see in other parts of the world. And as you can see on the slides, also in terms of the retail concept, how the stores are actually built, physically built, is very different. There's no promotion or marketing or point of sales, or we don't have even music in our stores and stuff like that. So it's quite different.
Thank you so much, Una. I think it's fascinating, and I think for people who hear about this for the first time, who haven't experienced it, it really is a very, very different way of really a very different system. And we've seen also that something that is said about Nordic alcohol monopolies is the focus on protection of young people, of youth. Can you say a few words about that? Is that also something you see?
Definitely. And I mean, it really is, we say, I don't know if it's a saying, but at least we at Systembolaget say that for some, it's important that we're open, but for others, it's important that we are closed, right? So once again, speaking about availability, and this is very much from a child and youth perspective, the fact that we are closed, that we have a very rigorous process in terms of looking more at the retail perspective of age verification. So you have to be 20 years or older to buy a Systembolaget. And our policies and processes for age verification is very rigorous. It's actually kind of like a standing joke in Sweden that if you get asked for your ID at Systembolaget, you have a very good skin routine because you look so young, because we do many age checks. But also that our staff and my colleagues in the stores are trained in so many ways, both in terms of course, products, etc., and customer service, but also in terms of public health and how to refuse sales, for example, if you suspect that the alcohol is being purchased for a minor. So this is not only, if a young person is buying to a young person, it could also be if a parent, for example, is buying to children, then we have, the right to refuse that sale. And this, of course, helps limit youth access to alcohol. But then we have also very strong commitment, which is part of our government task of informing about harms. Also, of course, the youth perspective there. I even brought some props with me, guys. Here we have some really nice
Amazing
pamphlets. This is called Tonårsparlören, which not actually sure how you would translate the teenage handbook, maybe, that is sent out to every single household in Sweden with children who are turning 14. So really practical tips on how to speak to your teenager about alcohol, how to handle those situations, and also resources on how to identify and help children that are in need, for example, this one. So you won't find a 50% discount, but you will find this in our store.
Mm.
And I think lastly on that point, I would say that I think the effectiveness of youth protection in the Nordic countries generally, with monopolies, where the monopolies are a key component, but of course not the only component that has to be part of a comprehensive alcohol policy strategy, but the effectiveness can be seen through the data. Recently, the EVID studies, right, with showing Denmark, of course, unfortunately the classic example, the only Nordic country that doesn't have a monopoly, and the statistics for youth consumption there versus in the other Nordic countries, it's quite telling.
Yes, thank you so much for that, Rona. It's great to hear about the different ways that this is being done. And I think what you touched upon at the end there was something I also wanted to ask on, because you're also a researcher, and except for this data in the Nordics, when you look at alcohol consumption and harm in countries with retail monopolies and without, are there any interesting differences or interesting things that you've seen as a researcher that you could tell us about?
Definitely. I mean, many things, and this research I'm doing together with Peter Allebeck and Anastasia Monson at Karolinska University, and I'm happy to be able to help on my weekends and weeknights when I'm not at Systembolaget. But I think one thing that is quite important, or has become maybe increasingly important for me, is that in the Nordic context, looking at the policies, what we can see is kind of currently a challenge to evidence-based policies, particularly in Finland. And when we're looking at the rest of Europe, what I noticed, we've gathered data right from 1990 until 2020 or 2025 in terms of alcohol policies, is that several countries who don't have, they don't have monopolies, but they are increasingly implementing policies in favor of public health. We can see this very much so in the Baltic regions. Just last month, I believe September? Yeah, last month in Latvia, implementing a new set of alcohol policies. And in the Nordic countries, there can sometimes be this kind of, you can hear in the public debate that, oh, look, we're finally becoming more like Europe. Let's, deregulate, and we're becoming like Europe. And then actually, when you look at Europe and the changes being made there, it's telling a different story, that maybe, these countries are actually looking at the Nordics as a golden standard for alcohol policy, and that the changes are going in that way instead. So I think it's an important reminder, especially for us in the Nordic countries.
Thanks a lot. I think that's super interesting, and definitely something to think about, to see where the inspiration of countries is coming from. You mentioned at the start this recently published WHO Europe report on the Nordic alcohol monopolies. I'd just like to quickly share a slide with the report that you can grab with a QR code here, as well as the executive summary. And in the chat as well, we will post a link to download this report from the website. So if you're interested in the Nordic alcohol monopolies also beyond Sweden, please have a look at this recent report. We have some interesting questions in the chat. I think now there's a lot of action going on there. So I think I would like to take a few questions maybe now here before we move on to the next segment. One of the questions here, which I think could maybe Taisha could maybe start with this. It's whether effect size of the different restrictions was measured in the IARC evaluation. So was there a difference in the decrease of alcohol consumption and alcohol harm from the different policies? And was the effect equal for all of the population, or was it more across different groups, like heavy drinkers or vulnerable groups as well? Can you say a few words on that?
Yeah, sure. So we didn't do a meta-analysis, so we didn't sum up the effect sizes for the different policies in that sense. But to give you a rough idea, the effect sizes go in this order. So total ban on sales, not surprisingly, has the biggest effect size in reducing consumption. Minimum purchase and drinking age has some big effects on consumption too, but you have to keep in mind that's for quite a small part of the population. Then days and hours, and then density. So it goes, that's from largest to smallest. I mean, the studies didn't always necessarily split drinkers in the way that that question is asking, but certainly I think days and hours of sales will be very relevant for heavy drinkers. I think minimum purchase age as well too for young drinkers.
All right, thanks a lot. I think that's great. I hope that answered the question there in the chat. One that maybe I can address to you, Juan, there. It's about minimum drinking ages. So the question was, is there any evidence showing that differentiated minimum age is insufficient? So for example, having 16 years for buying beers, 18 years for buying stronger alcohol. Is there anything like that you could see, or maybe Taisha also in your looking through the evidence? And does the evidence show that minimum age reduces youth drinking, or does it show that reducing drinking on the population level? Yeah, so does that show like reduced adult population drinking as well? I don't know if that makes sense. Do you want to start, Juan?
Yeah, I can give a try. Yes, absolutely. We have recent evidence that maybe it's not at the population level and not necessarily will meet the criteria, for example, that Professor Harcourt was mentioning around inclusion in this type of a study that the IARC had conducted. But we do have increasing evidence related to the onset of age, drinking age, and the influence of that in the adult behavior for drinking. That means that more we delay the onset, so the starting of drinking, more we tend not to drink in our adulthood. So that's very clear. The other piece of evidence that is also we can find more evidence, and there are a few publications where we have reported this evidence as well, as WHO. I mean, we see that after 21 until 25 years old, the cortex, the frontal cortex of the brain is still developing. So more we delay the starting age as well, that more protects the youth. And yes, it has an impact on the youth study, but also in the overall per capita consumption, of course, at the population level. I hope that more or less addressed the question.
Thanks a lot. Yes, I think so. Just Professor Hackel, if you want to complement with anything, was there any differentiation among the minimum drinking age, any golden drinking age standard that you saw in the evaluation, or any other things you saw?
I believe the golden age is 21.
All right. Thank you so much. That's very clear. I'd like to take just one question and one more question, and I think there were a few that I would bunch into one. It was around something that you mentioned, Juan, around implementation at national level. So if there's anything you can say about thinking around next steps to support implementation for countries of these policies.
Yeah, we have been, I think, of course, the different regional offices have been developing new tools, particularly the European region has always been the spearhead of many of these interventions. So you will have more concrete plans on how to facilitate what we will say interministerial or intersectoral communication in order to progress quicker and to get a better understanding of what each country needs to be done. We have, as WHO facilitators, this dialogue. We will continue to do so. We have also been able to publish a few tools, particularly related to taxation and how the different countries across the world are implemented taxes or health taxes, but particularly on alcohol. Early this year, we published also a manual on how to legislate, with a lot of material there for countries to start applying many of the big principles and intervene more at the regulatory level in each of the countries, with many examples as well. We have been collaborating, of course, with the IARC also to have this manual out, and hopefully it will take place also in a month's time. The plans are to continue on this line. We have also created a momentum. So a few countries has approached WHO for specific technical guidance. On this, we are supporting a working group on how to implement labeling at the global level and develop standards for codex. So there are many initiatives that, yeah.
Thanks a lot, Juan. I think that's great, and I think a good key message that WHO is very approachable and happy to support countries both at the global level and the regional levels in what concerns the implementation, but also providing the evidence as you heard during the webinar here. And you mentioned again, brought us back nicely to the IARC handbook that we hope will be launched in October 20B on alcohol policies. IARC is, of course, the agency on cancer. So we were hoping also to include into this program some estimates on how many cancers could actually be avoided in the European Union if the availability policies of the IARC Handbook 20B were implemented. And for this, we have with us Dr. Jürgen Rehm. Jürgen, can you tell us a little bit about that? What would happen in practice?
I'll try. I'll just share my screen. You should see my slide. Obviously, we've talked about 5 different policies, and some of those policies we will not estimate for reasons that they're currently quite unpractical, like a full prohibition, for example, which so we are trying to give you a teaser of what happens with availability policies which everybody can implement. And so we came up with, we always give this based on studies which were selected as having those quality criteria which Tasia has given us. So given that in Europe right now, all but in the EU right now, all but Sweden have Sunday openings, so you can buy alcohol on Sunday. This is not the case in many US states, as you may not know, but it is true. So we have evidence about Sunday closing. What happens if we implement Sunday closing? What happens if we give up Sunday closing? And basically, we estimated what would happen if the EU would adopt a Sunday closing law for alcohol, and what would happen specifically for cancer, because this is all part of the IARC handbook launch. And we will do that for every policy. You've seen that we've done it for taxation. We will do it for a ban on marketing in the next time. But for specifically the Sunday closings, we would experience around 5,000 new cancer cases less. And that would be close to slightly more than 0.5% of all the new cancer causes, which are causally linked to the region. Meaning, alone this one policy restrict sales on Sunday already would make quite a sizable effect on new cancers. And if you combine that with all of the other policies, the effects would be larger. So that is my sneak preview.
Thank you so much, Jürgen. Very exciting. So I think, yeah, I think just showing, you know, one day change and a Sunday just before the work week, and would still make a huge difference. I think that's very telling. So we're excited to see more results once you have them. Colleagues here, speakers in the webinar, any reflections you have to this, to the potential of availability policies to reduce harm and cancer cases? Anyone want to say a few extra words on this? I can't see them.
I'll just chip in a little. Yeah, absolutely. Thank you, Jürgen, for that analysis. I'm very intrigued to see what's going to come next as well. It's really great to actually see some of the policy effects being translated into cancer, because we don't necessarily have the best evidence on that yet. So this is really good. And so based on that one little taster, I'm well in support of introducing availability policies in terms of restrictions to reduce cancer and reduce harm.
Great, thank you so much. We have a few more questions here in the Q&A that are fairly concrete. Some of them are around on and off sales, for example. So whether there are any practical considerations. I don't know if this is one of the things that you, Juan, said under, you know, it needs to take the country context into account, or is there a classic good price differential between on and off sales, which can help reduce off sales purchase? Is this something that we have evidence for, or is this something that varies?
I'm not sure we have evidence. Maybe the other colleagues can help on that. But the distinction, of course, it's relevant. Thank you, Peter, for that comment. It's because many of the measures that we can implement, of course, need to be tailored to the harm that alcohol causes, and the differentiation between in premises, on premises, and off will help also to tailor those restrictions to the different context and to make them more effective. And that's the first reflection that I have. But I see Jürgen will help me out. So
Great, thanks a lot, Jürgen.
Basically, the main harm which is related to on-premise has to do with nighttime violence and all of these consequences. There's a lot of social harm involved. There is anything from date rape to actually homicides in some countries in quite high rates. So if alcohol policy is always based on opportunities, if in a country there is a huge outcry about those kinds of things, it is easy, and actually the population usually supports restrictions in online premises, in online premises, especially during nighttime. However, if you look into the overall harm, and there's not a specific concern about violence in a country, the bigger effects you will get from the offline sales. And that's especially the case because it's not only violence and some specific kinds of injuries, but it involves all injuries, and it involves a lot of cardiovascular deaths on Sunday, because a lot of countries drink a lot on the weekends and have this little, not little, we are speaking about thousands of deaths, bump that on Monday cardiovascular mortality goes up. And we have shown that countries who restricted Sunday sales to 5 hours, for example, Lithuania, actually had a drop on Monday cardiovascular deaths. And this drop was sustainable as long as the availability restrictions have been lasting.
Thanks a lot, Jürgen. I think that's a great addition and very clear, very concrete. Something that I think we get asked a lot, and maybe it can be a last one we address today, is how countries can address illicit alcohol production and sales while they implement alcohol restriction policies, such as availability policies. Jürgen, do you want to say a few words about this as well?
Yes, it's one of my, again, the illicit alcohol, the unrecorded alcohol, as it's the WHO term, depends on what we're talking about. We have third night shifts, meaning factories, producers of alcohol illegally produce alcohol in extra shifts and sell it without tax cheaper. That's a completely different than if you go to the next country and buy alcohol, or if most of the unrecorded alcohol is produced at home, for example, as spirits, which is easily to produce. So the basic gist is that all forms of illicit alcohol demand country-specific, solutions, and those country-specific solutions do exist. For example, Russia had one of the biggest problems of unrecorded alcohol worldwide, and one of the major ways was to introduce a registration system, EGAs, which basically helped reduce the unrecorded alcohol. And such a registration system is possible, and countries like Kenya have shown that it actually is cost beneficial to a country to introduce such a system, because they shifted a lot of the unrecorded alcohol into the recorded alcohol and got taxes for it. But again, a lot will depend on the exact way where those unrecorded alcohol stems from and what are the consequences.
Thanks so much, Jürgen. I think that's great, and an answer from a person who has heard this question many times before. I think maybe we just have time just for a tiny last question in terms of what would be great in the future. Would we like to see monopoly systems? Could we see more of them? Do we think will they sustain the alcohol monopoly systems, or are countries going a different way? I think you alluded to it a tiny bit, Runa, but if you want to say just a few more words on that, what are your thoughts on availability policies and monopoly systems?
Well, I sure hope they they stay, so I get to keep my wonderful job. No, but mainly because it is a great policy. I think something to keep in mind is that, you know, public opinion and then what happens policy-wise is not always goes hand in hand. You can see it, you know, in Finland currently, and in Sweden, Systembolaget has huge support by the general public. So hopefully, you know, we keep developing and keep implementing policies that we know work for public health, for youth. And hopefully that is the future ahead of us. But yeah, you never fully know, do you? So
yeah.
But if anyone, can also say that unfortunately, as I said, I'm on my phone and it keeps acting up. So if anyone has any questions to me specifically about monopolies, please do email me. I can't answer in the chat currently, but I will gladly answer any of your questions. So maybe someone can share my email at some point.
Thanks a lot, Runa, and thanks for the generous offer. There were a couple who had very practical questions in terms of some of the guidance and materials that you showed as well. So definitely. And we've come to the end, unfortunately, of the webinar now. I think it was a super interesting discussion. People still have questions, I can see. But we'll see what we can do with that post-webinar. You will receive the presentations at least, and some extra materials from us. Juan mentioned the next and last webinar in the series will be on the 24th of September. I'm sharing a link for everyone in the chat. And with this, I'd like to say a huge, huge thank you to all of our panelists today. Thank you for joining us. Thank you to everyone watching as well. Take care.